31 million Americans are not getting coverage tomorrow, and in fact they're getting coverage starting years down the road. I think we would probably, in as much as we're all, moral people, we'd like that to happen sooner rather than later. 123 people, 123 Americans will die today and tomorrow because of inadequate access to health care.
They can walk into the hospital tomorrow and get the service they need. These are the things that are upsetting people. Statements like this don't have a lot of truth in them because those people could have gotten coverage by walking into the hospital.
Well, I want to come back to the gentlelady's question.
Sure.
What you say is also accurate to a point. If you get hit by a car in this country, you get treated in a hospital. If my wife is diagnosed with breast cancer, her life will not be saved in an emergency room. And even if we decide, which it sounds like you're arguing for, that we ought to treat those 31 million people in emergency rooms, somehow we're going to do chemotherapy and cancer treatments in emergency rooms, which is not at all what emergency rooms are designed to do. Even if we agreed that that would be the best venue, that is the single most expensive place in a hospital to treat somebody. So let's get people out of emergency rooms who are seeking primary care in the most expensive environment. That's crazy. To your point, I don't want to dodge the question here. I went through earlier a lot of the mechanisms that have been put into place to try to grow the number of primary care providers, doctors, nurses, home health care, etc. That won't happen overnight, but neither will people be covered overnight. And so, there are theoretical slots, scholarship repayment programs for nurses that are designed to grow that primary care infrastructure. A 10% reimbursement bonus, is you worried about Medicare reimbursement? Let me say it again. Providers, doctors who serve Medicare patients, primary care doctors get a 10% bonus on their reimbursement. So I think we've addressed some of the challenges that you may be worried about. I need to take some questions from folks that haven't asked it. Yes, ma'am, all the way in the back. Payments to hospitals which reduce the rate of readmittance to the emergency room. This is a serious problem for the system. Some of you have experienced this. You get a disease, you're in the emergency room, they treat you, you're back there the next week. Oftentimes, that happens because the hospitals don't have a clear incentive to prevent that from happening. Hospitals will now receive bonuses if they keep people out of their emergency rooms, if they treat them in such a way so that they're not readmitted. So lots of these ideas are in there. What's hard, and I'll say right up front, I'll go to a larger discussion of healthcare reform. You can calculate the cost of covering 31 million Americans in real detail, and it's not cheap. What's very hard is that on the cost-saving side, we're talking about making Americans healthier. We're talking about trying whole new models of healthcare delivery. You can't be certain of the savings. You can't be certain of when they will kick in or how much they will be. And so we're trying everything, as Atul Gawande encouraged us to do, on the expectation that some of these things will begin to provide more efficient, better, lower-cost care over some period of time.
One thing we can't be certain of is that with this healthcare bill, our country will go broke. Just like all these other countries.
Ma'am, if you don't mind, can I call on people so that everybody gets a chance?
We're paying for it. Taxes.
If it's okay, I'll call on everybody, but let's show a level of courtesy to everybody. Yes, oh, hello.
Hi, how are you? Thank you.
You want to use it?
Please, thank you. Good afternoon, everyone. Dear Congressman Mr. Jim Himes, my name is Maria Blanco, coordinator of Hispanic Committee of Health Reform of Stanford and the Westport Child Advocacy Coalition. On behalf of the Latino community, we want to say thank you very much for all the efforts you do in health reform. How you said, after waiting for a long time, finally, we will see hundreds of thousands of families improvements in our coverage or benefits from provision in the health reform legislation. We feel so proud about you because you listening our families, our small business, instead the big insurance companies. Your honesty and hard work was the key to conquer our community. You are demonstrating that we can count with you.